Okay.
My assistant. Good morning, everyone. It's Dr. Carol Lourie, and I'm here with one of my dear friends and colleagues, Dr. Chris. And I'm not sure how I pronounce your last name correctly.
Bjorndal. Bjorndal.
Bjorndal. There's my Philadelphia accent coming into play. And I'm very excited to be here because Dr. Chris's area of expertise is emotional wellness and mental health from a naturopathic perspective. And I think she's really the only naturopathic doctor who is totally focused and devoted to this very important area. So, welcome and thank you so much for being here.
Yeah, thanks for having me. It's good to be here.
So, emotional wellness, I like that phrase. I don't think there's enough focus on it for people in general, but especially for women who have gone through some serious chronic illness such as breast cancer. Do you want to talk a little bit about your perspective on emotional wellness?
hmm Yeah, I mean, a lot of times, we're really concerned about the physical aspect of everything. And what I like to explain to people is, there's more to us than just our physical being. So we have the emotional and also the mental and then the spiritual pieces of the puzzle. So the emotional side, if we don't learn to navigate the and it's almost like if we look at it like a slinky, all the emotions, they can spiral, right? We can move into anger, or we can move into fear, we can move into worry, but we can also move into joy and happiness and bliss. And just understand that all of those emotions live within you, sadness, grief, etc. And so you're essentially the home. And there's no bad emotion. We tend to judge it as so, but really it's just energy in motion. And so what is it that, if you want to look at what might you be blocking within yourself, or what are you not allowing yourself to feel or express? And sometimes this is challenging if you haven't learned how to do that in the environment perhaps that you grew up in.
Oh, I'd say most people do not learn how to do that in their environment of their childhood. It would be a very unusual environment. Maybe younger than me, but I mean, my generation, it's like that wasn't part of the dinner table conversation or the breakfast table conversation. So let's just assume that most people don't know how to do that. How do you even begin
Mm-hmm.
to realize I mean, I'd say if you're unhappy and if you're unwell physically, then I think 1 + 1 = 2. Pay attention to the clues. I think it's safe to say that we have a problem that we need to look at. So let's just start with that. Would you agree to that as a
Mhm.
perspective?
Yeah, absolutely.
Yeah.
Yeah. Yeah, for sure. For sure.
So
Yeah.
you acknowledge that there's a problem because you're not happy, you don't have joy, or you're too anxious or depressed too much of the time. How do women then go from that initial assessment to figuring out how to begin to unravel the onion, so to speak?
hmm Yeah. And so really what we want to understand is, I think first and foremost, we don't want to discount any of those areas that I mentioned, right?
Of
So
course.
we kind of want to start with that physical piece first and make sure that that's dialed in. So we want to take a look at what's happening from my neurotransmitter perspective, my hormones, and then my organs of detoxification. Because those are the three main macro systems in the body. And any one of those, if they're out of balance, can result in symptoms of emotional, unwellness, depression, anxiety, stress, not sleeping, those kinds of things. So first we want to make sure, okay, are we dialing in, the nutrition, or what's happening with sleep, what's happening with stress, right? What's happening with the movement? And say we're doing great in that department. Because that's essentially what happened to me, right? I had a lot of depression, a lot of anxiety, worked on the physical stuff, got better until I wasn't.
You
Right?
hit a plateau and
Yeah,
then you go, well, I'm still not great. Maybe I'm 60% or 70%, but I want 80 or 90.
yeah.
And but I just want to say before we even go any further that what Dr. Chris said about looking at your neurotransmitter levels and your hormones and your gut health if you go to your regular doctor and you say, I'm out of sorts, I'm depressed, I'm anxious, in 2 seconds, they're going to pull out their white prescription pad and say, well, let's just put you on XYZ. So, which drives me crazy. Because the neurotransmitters, the hormones, the gut health, the inflammatory markers, those are areas of naturopathic doctors' perspective, not or an integrative medical doctor. It's not the normal Kaiser or PCP physician. So everyone needs to know the right person and to have the right conversation with them, right?
That's right.
Yeah.
And also, please, you best. Like, you're in your body. You live in your body. Don't let any doctor tell you that, like, dismiss you, right? So your body is always talking to you. And so but the problem is most of us aren't listening. But the body is speaking to you in the symptoms that show up. The symptomology picture is the body talking. And we got to just investigate and figure out, okay, which one of these macro systems, or all three of them, right? In my case, it was all three that I had to work on. So, but I just want to really leave you with the message that there is an explanation for what you're feeling and what you're experiencing. It's not just all in your head, if like
Well,
say.
even if it was all in your head, even if it is, it's still fine.
Yeah.
Right? I mean, that's, oh, don't worry about that. It's all in your head. That, first of all, that's horribly condescending. But let's say hypothetically it is, and Dr. Chris and I don't feel that way. But even if it is, so what? It's still real, and we need to address it, right?
Yeah. Yeah. And so I think the thing is that a lot of people just don't feel heard. They don't feel like they're being taken seriously, being listened to. So this is important to be able to advocate for yourself, because at the end of the day, I think, we're coming through a time where we didn't take responsibility. We would like, oh, I'll go to the doctor and the doctor knows everything and
Oh, yeah.
they'll tell me what to do. And then
That's real.
yeah.
And yeah, when I was growing up, the doctor in the white coat, first of all, the word doctor was unconsciously synonymous with man.
Yeah.
Thank goodness that's changed. And the doctor knew everything. Oh, the doctor says to do this, I'm not going to question it. I'm just going to do this, right?
Yeah.
And I think that as women, we've become more empowered, first of all, but also the other side of this is when you're not feeling well, it's very hard to advocate for yourself. And that's why you need someone such as Dr. Chris or myself in your front pocket, not your back pocket, to help you navigate the system so you get the care that you need.
Mm-hmm. It's so important. It's really important. Yeah. So once say you've got that all, it's all sorted out, but you're still experiencing reactivity, you're upset a lot, you're just, and that's kind of then making you question and move into anxiety and depression again. So that's when we want to look at these other pieces of the puzzle, which is your thoughts and your emotions. So if you're somebody who's experiencing emotional reactivity, often it stems from trauma. So we learn these patterns of behavior going, and Dr. Lourie said a moment ago, like the onion, right? And so if you visualize yourself as an onion, the core is the center can be, your soul or your spirit, if you will. And then we have all these layers, which is all the years of our lives, right? And then on the outer layer is kind of where we are now. But that center piece is still there. And if there was something that happened, even if we go back, we can even go back to this idea of intergenerational trauma.
Oh, 100%. Let's wait. A lot of people don't know what that means. Let's explain what that means. Okay. So go ahead.
So what that means is that when your grandmother was pregnant with your mother, you were there as an egg in your mother's ovary. So energetically, whatever your grandmother was going through, it has an imprint, an energetic imprint, if you will, on you, perhaps. So there's a book called It Didn't Start With You,
Oh,
by Mark Wolin. And this is, interesting. So I'm adopted. And so I start my book with an introduction about how the stresses that a mother might be going through when you are in utero, which your mother might be going through when you're in utero, can affect you as this developing fetus. And neurologically, this neurological and emotional imprinting happens then,
hmm, hmm.
right? Now, I don't remember being in the womb. I'm sure you don't remember being in the womb, but we have this implicit memory that's there. And then we wonder why we walk through the world and somebody nudges us. And I'm using a nudge as an example as maybe as an emotional insult.
Right,
Say someone
right,
stubs you, or you don't get a job, or you lose a relationship, or you whatever it could be, and then you're just you can't handle it.
right. Now, in homeopathic philosophy, what you're talking about as intergenerational trauma is they call that a miasm of energy.
Yeah.
And I'm a homeopath, and people come to see me and they have these symptoms and they describe, and it's like I'm thinking, well, they have an illness, but they didn't have it. Maybe their great grandfather had it, and the energy of that illness or grandmother is, energetically pushed onto them. So, there is this philosophy in regular or allopathic medicine. You have to be able to see things like bacteria and viruses. Their illness and emotional wellness and everything and disease have energy. They all have energies to them.
Yeah.
And we're talking about that. And it's very important to, you can hear your mind. I'm sure there are women out there listening to this going, oh, what are they talking about? What? And they're off on the deep end with this weird touchy. I have people email me and afterwards and saying, there you go again. You're in the weird touchy feely zone. And I write back to them. I go, yes, thank you so much. I'm glad you enjoyed it, because it's more than what you can see on your pathology report,
Yeah.
right?
Yeah.
We're talking about, just because you can't see it doesn't mean it isn't real,
That's
right?
right. Yeah, and to sort of back us up a little bit, there's the chakras, right? There's Ayurvedic medicine. They have the
Mm-hmm.
7 energy centers of the body. Each one of those is associated with emotions. Same with traditional Chinese medicine,
Chinese medicine, yeah.
right? We've got every organ is related to an emotion as well. So there is actually science, behind this as well. So I think they are catching up, to these ideas. But it's really it's such an important piece, and we really want to understand that and to keep it kind of in the Western world, just understand that your nervous system has basically 2 branches, and one's called the sympathetic, the other one's called parasympathetic. And other words to describe those would be stressed or relaxed, inner critic, inner cheerleader, sabotage or support, hurt, help, ego, soul, fear, or love.
Mm-hmm.
And so you can't be in both states. You're only in one or the other. And so I ask my patients, okay, if we just look at that as 100% sympathetic, parasympathetic, tell me, where are you spending most of your time? Very rare for me to get, oh, I'm 100% parasympathetic. It's like, no, I'm 90% sympathetic, 70% sympathetic, right? And so it's this idea of stress is such a really important piece. And if you don't learn how to navigate that, then you will end up with chronic health conditions. And we're a very stressed society.
We are. We are.
Yeah.
And if you are in the parasympathetic state, it's important to know, as you just said, to have moments where you turn the volume down on that. And Dr. Chris
You're in
and
a
I were
sympathetic
talking
state.
about, parasympathetic,
The
sympathetic, sorry.
Yeah.
Yeah. And we were talking about that, and I said, I have a lot going on with me right now, and I have to really monitor my stress level. And I do my power walks. I make sure I take my supplements. I'm eating well. I have a few minutes every day where I do something that is not about work. It's just enjoyable. I do meditation. And so there are ways of lowering your stress level 100%.
Mm-hmm.
So, and you can learn them, right?
Mm-hmm. Yeah. 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 I mean, we talk about, it's probably, I'm in Canada, it's probably the same in the United States. The top 5 things that get Canadians at the end of the day are heart disease, cancer, lung diseases, type 2 diabetes, and then mental health. But what's behind every single one of those is stress. So we can say the top 5 things that get us are stress, 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 and stress, right? So,
Smoking, lung cancer, smoking.
yeah. Yeah.
Yeah, 100%.
Yeah.
And smoking is a stress reduction. A lot of people pick up smoking because they think it's going to help them monitor their stress, right? Reduce their stress.
Well, and they think it's gonna, like, it calms them, right? In the moment, right? It's a calming to the nervous system. It's like a
Mhm,
relief, right? But we want to learn healthier ways to cope with,
mhm.
with it. And so it's important to take a look at that piece, for yourself, everybody, who's listening, to take a look at that piece of the puzzle and look at your plate and what do you have on it. And I know it's difficult. I get it. I mean, I don't live in isolation, a little bubble by myself. Like, I get it. It's difficult when you're parents and you got children and you have aging parents and you've got partners and you got your entrepreneurs. Like, I get it. But I also understand that you got to get this. Like, you have to get this. This has got to be. And just like Dr. Lourie was saying, she has all these, even though her stress, she's got things going on, she's got this ways that
Tools.
she's used, yeah, tools that she's using to navigate her life, right? And so, and I have tools. And so the question becomes, what tools do you have? And if you don't have tools, then let's teach you to have some tools.
Exactly, exactly. And um, you can't continue down the path of stress mode without doing these interrupted, pleasing pleasure patterns, or because that really makes disease. And as somebody who talks to hundreds of women, like in months, and so as does Dr. Chris, we see that there's certain ways people are that they end up with XYZ disease or mental emotional illness. And it all has to do with too much stress piling up and until your system collapses.
Mhm.
And I think that I want to encourage everyone to really become more sensitive to the fact that you're overburdened, and it's a sense of strength to say no more and ask for help.
Yeah. Yeah. No is a complete sentence.
Yeah, and notice you don't have to say I'm sorry, but no. I
Mhm.
always say to that, when one of the things as the energetic miasms for breast cancer is that women are always taking care of other people,
The nurture.
and right,
Yeah.
and we tend to do that anyway, whether we have breast cancer or not. We just are caring and giving, and we say yes too often. And if you decide to become on the road to health, you need to start saying no. So there's this tendency to say, oh, I'm so sorry, but I can't. And
Mhm.
I want to encourage women and empower women to say, I'm not able to do that. And that's it,
Mhm.
period, not an explanation. And it's interesting when you start saying no to notice how people who you think are your friends start reacting.
Mhm.
And if they start getting pissy and not nice to you, that is a major clue that they're in the relationship with you for their needs and they are not there for you. And that's a lot of people have, totally divorced certain friends and had to start over in their friendships as they become healthier. And I actually think that's a beautiful thing.
Mhm. Yeah, there's a lot of imbalanced or toxic kind of relationships out there. And so, it's, I'm a recovering people pleaser, a recovering sort of type A overachiever type. And I think that there's an element of people pleasing in breast cancer, in the sort of the personality type, if you will. I mean, that's a very general
Mhm.
statement to
Yeah,
make.
it's general, but still.
And so I guess what you want to do, if you're somebody who is is busy serving everybody else, like at the expense of yourself, first you want to bring awareness to that, and see if is there a role in your life that may not be serving you, because that's the thing, right? We play all these roles, right? We're wives, we're mothers, we're sisters, we're colleagues, we're friends, but where are you in all of that? So making sure that you're building that time for you. And then learning to navigate boundaries is really, it's just so important, right? And the first boundary that goes for a lot of us is with respect to the things we need to do, like sleep, right? And the exercise and the eating. So we often sacrifice those three things, and you just can't. Your health really depends on it. And
Yeah.
then the other thing I was going to say about boundaries is, um, it's just important to, essentially, there's like, in myself, I've noticed it's like there's these two voices, if you will. There's the whispers from my soul, or my spirit, my intuition, and then there's like the megaphone of my ego, right?
Yeah, that's interesting that you put it like that. Whispers from your soul.
Hmm. Yes. So the ego, not that it's a bad thing, it's just that we have to really, what I've had to do is learn to push the pause button, right? Learn to say, hey, somebody asked me to do something. I say, hey, can I get back to you?
I love that. That's a
Right.
great way of responding. I'll think of it. Can I get back to you later? I got to look at my calendar. I got
Yeah.
to check in with myself.
Yeah. And that's exactly what you're going to do. You're going to check in with yourself, and you want to lean in and see if you can, is this a hell yes for you? Because if it's not a hell yes, then it's a
Hell no.
hell no. Well, yeah, I was going to use another swear word, but I'll be polite. So,
Okay.
right. And it's hard. And for me, it's like I sit with myself, I say that it's a no, and then I find yes coming out of my mouth. It's like, what's going on there?
Well, that's why you can respond by text,
Yeah.
because it's easier to say, thank you for the opportunity, but I looked at my calendar and I'm too busy, or whatever.
Yeah.
That's texting. It's okay to say no by text.
Yeah.
That way you're not inclined to be canagled into saying, oh, yeah, sure, I'll do it this time. But I think saying no is a learned skill,
Mm.
especially if you're used to and you're ingrained from childhood. The messaging is very subtle to say yes. And
Mhm.
mental health and emotional wellness, it's not just one thing that you do. It's not like the messaging we get from American advertising. This is really important because this is the unconscious process here. The commercials for depression are 90% about women. And there's one in which it's a section of a house in which the house is a mess, quote unquote. What does
Mhm.
that mean? The beds aren't made, there's dishes in the sink, and there's a pile of laundry. Now, when I first saw that, I was by myself and I started screaming at the television. It's like when I had a little girl and I was working, I didn't always make my bed. I had dishes in the sink and I had piles of clean laundry waiting to be folded, and I wasn't depressed. But what is the messaging of that for women? And
Mhm.
why is it only about a woman? Where's her partner, whether it's a man or a woman? It's the whole household's responsibility to keep the house running smoothly, not
Mhm.
just a woman. And then she takes an antidepressant, and the next image is everything's in spick and span, or she's serving her family a picnic lunch.
Wow.
Yeah, really. So you need to become radicalized to being outraged about the messaging women are getting about emotional wellness and mental health. I'm thinking, what was, she was sitting on the floor by the kitchen like this with her. And I'm thinking, well, what happened to her that made her feel so unwell? It
Mhm.
wasn't, you don't wake up one morning like that unless there's some acute tragedy in your family and not, feel so horrible. I mean, it's a gradual winding away of your emotional wellness and increasing in unhappiness that you end up like that. And I think it's, we're conditioned to, you go to the doctor, you get a pill, and you wait for the pill to work. Now, I have my own feelings about antidepressants. My attitude is they don't work so well. They stop working after a while, and there's a lot of side effects, and they're too easily prescribed.
Mhm.
But when you think about emotional wellness, there's a lot, as Dr. Chris was saying, there are many components of it that you need to attend to on a consistent basis. It's not like you can just say, oh, I'll deal with it later. And then 3 years down the road, you've realized you've been extremely depressed for 5 years.
Mhm. Mhm. Yeah, I mean, and sometimes it is like a gradual slide sort of down, and other times it's faster for people. Um, but I think for myself, it's been really important to look at my sensitivity and my ability to make my way in the world, and the tools that have helped me the most have been learning how to recognize, first of all, to have awareness, right? Like what's happening inside my body. Is my heart beating fast, or how am I breathing? Do my hands sweaty? Like those are all cues that you could be moving yourself more into a sympathetic, or we use the word anxiety, right, state. But the question is, what is actually going on in the outer world, and is there anything in the outer world that's contributing to this inner environment? And this inner environment, as we remember, can go back quite far, right?
Yes.
So there's there's a lot of talk right now about trauma, right, and its impact. And it's, again, what can happen is, in childhood, there's kind of three needs that we have as children. We have the need of attachment, we have the need of attunement, and we have the need of authenticity. So we need an adult to be attached to us. I mean, we're one of the only mammals that kind of, raises its young till they're 19 years old, right? I mean, most mammals, they're not raising their offspring that long as we are as humans. So, as a baby, we need somebody to be attached to us. Otherwise, we're not going to survive, right? And then we need, in order for that attachment to happen, we need the parent to be emotionally attuned to us, to our needs. But what can happen as if in the environment, if the adult is not emotionally attuned, or if the parent is going through their own things, if there's drug abuse or alcoholism or any kind of those big, really traumatic events happening, what we learn as the child is that we learn it's not really safe to be ourselves. It's not really safe. So the authenticity piece gets sacrificed. And so then we wonder why we are the way we are, because we've actually suppressed, or it just wasn't safe for us to basically express ourselves, because there was a threat to the attachment. And that's the primary need. And so it's this tragic conflict that happens all the time.
It is
All the time.
tragic. It's tragic.
Yeah.
When you were talking about the three needs, I was having an image of what happens in the wild with gorillas and how they raise their babies, and how they keep them close. And I just saw this National Geographic about orangutans and sloths. So there are these mammals that are also very connected and very attached to and elephants also, to their young, but they don't do it for 18 years like we do. But and a lot of, as our children grow older, they get more and more separated from us, as is necessary for their emotional wellness. But those beginning years are really critical of keeping them close. And I think that there's a lot of pressure on women to be like perfect moms. And I had someone who was saying to me for many years, you just need to be good enough. And we all have our own, I want to use a Yiddish word, shtikalach. We all have our own problems that, even though we've worked on them and we do our best, some of that stuff does get put on our kids. And that's just the fragility of being a human being and being a mom. And I think that if you give them enough, it sort of works out in the wash. And it's also important to know that sometimes your kids need to go to therapy. I mean, that's also an important aspect of being a good parent. Your kid needs to get some help so they can grow up to be a happy adult. But and as Dr. Chris said, we know we have colleagues who specialize and do summits on trauma. There is a lot of that happening right now. And I don't think it's an accident that all this trauma awareness is happening when the world is in such a traumatic, discordant place. How do you feel about that?
Hmm. Yeah, I mean it is, and I think it's an important piece that hasn't been looked at, right? It's sort of been pushed under the carpet, if you will, and sort of swept to the side, and so now it's it's you can't, and it's kind of similar with how our philosophy in our medicine. You can't push things down. It's going to come out in some way,
Mhm.
shape, or
Yeah.
form. Eventually, we got to look at these things, and so now is the time, right? Now is the time to have awareness that. But what we really want to do is look at, well, what's behind the behavior. So it's not about blaming people. It's really about just seeing how much can we bring some compassion and empathy to these souls that are, because there's a lot of people that are suffering,
Mhm.
and people are today. There's still lots of issues with drugs and alcohol, and
Huge,
you know,
huge. Fentanyl is just, I mean, it's
yeah,
tragic. It's ruining families. It's killing people. It's a very hard drug to get off of. There isn't enough mental health support. It's lacking. Um, so, Dr. Chris, I had your book. I had actually two copies of your book, and I lent them to patients, and guess what? They never returned them. So, do you happen to have a copy of your book that you can show
mhm,
people here?
yeah.
And I'll put the name of it on for people to look for on Amazon because it's a really, really good book. If you're suffering beyond the label,
There you
yes.
go.
You gave me one at Mindshare, and I had it in my office, and it was in my waiting room. And a woman came in, and she was really suffering emotionally, and she had started to read it. And she said, "Can I borrow this?" And I said, "Yes, but you have to return it." Well, she never returned it, so it was
Oh
my.
no.
That's why I asked you to have it. So thank you. And you're writing another book now too, right?
Well, I was going to, but it's kind of hit the back burner now. So I'm not. I was going to do a book on more the eating disorder
Uh
side of
huh.
things.
Yeah.
Yeah, I've had an eating disorder, and I don't really go into it much in beyond the label. I just sort of mention sort of as a side note. So that's the book I did start, but I haven't. I've just been too busy. It's been really busy. So
Well, that's a beautiful thing that you're busy.
yeah, yeah. I mean, it isn't, but I just wish I wish there were more people that were willing to work in the mental health area. We need more soldiers on the ground, you know,
Soldierettes.
people.
Well, you can bring in, hopefully, some, naturopathic students will come into your practice and join your practice and, be able to provide the care that's needed up in Canada. And, in the US, we all need to do that also. And I think the beauty of naturopathic medicine, as far in the frame of mental health and emotional wellness, is that, and it's what we started the conversation with. We look at not just what's going on in your mind, but we check in with what's happening in your body, and we really bring in the mind and the body together. And I think that is very different than standard allopathic psychiatry or what you'll get when you go to your primary physician and out comes the little white tablet with the phrase, "Let's just put you on." I hear that a lot from women who've had breast cancer, and they come in and they're on three different types of anti-anxiety and antidepressant medication, and they wonder why they're not feeling like themselves. Yeah,
Mm.
I wouldn't be either.
Mhm.
So, once you get on that medication, you just can't necessarily stop it cold turkey. You have to get off of it in a very specific way. So, if you're listening to this, ladies, don't decide to stop taking your psychiatric medication without proper guidance, please.
Mhm.
Yeah.
Yeah, yeah.
So, Dr. Chris is up in Canada. Do you do consultations by Zoom, or are you only in person?
No, no, I do them by person, but my one-on-one is full. So,
Oh,
but
wonderful.
I have a group program that I'm launching in a couple of weeks here. So that's
Oh,
an opportunity for people to do it. So where I go through the 10 steps that I talk about in my book, and so that's an option for people.
okay. When your program is ready, email me and I will promote it to my community. Okay.
Okay, sure.
Yeah, happy to. So, everyone, when Dr. Chris's program is ready, I'm going to post here. in the Facebook page, the Facebook group, and if you're on my email list, you'll get an email about it. And I want to support her because, first of all, she's a wonderful person, and second of all, she's great at what she does. So thank you so much for being with us, Dr. Chris. I really appreciate your time.
Yes, of course. You're welcome. Thank you.
And ladies, it's Kira Lourie. I'm signing off for now, and there'll be more tomorrow. Have a lovely day, everyone. Take care. Thank you, Dr. Chris.